If a patient has true fat prolapse or herniated lower eyelid fat pockets, also known as eyelid bags, the treatment is surgery.
Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
Today, I'm going to be speaking with you about a very common condition that I see in my practice on a daily basis, which is dark circles, and what are the best options in treating dark circles. So there are various causes that can result in dark circles. So it's not just one particular cause that results in dark circles. For instance, fat prolapse in the lower eyelids, which are often called eyelid bags, is a very common cause of dark circles. 2, volume loss or hollowing along the under eye area or the infraorbital rim, also known as the tear-trough if it's just hollowing in this particular area, is another cause of dark circles. 3, hyperpigmentation. A true hyperpigmentation of the skin, of the eyelid skin, can also cause a form of dark circles. 4, allergies. Patients that are prone for having recurrent allergies or issues or swelling around their lower eyelids are also prone to having dark circles. So in terms of treating dark circles, first, the most important thing is to identify the cause of the dark circles. If a patient has true fat prolapse or herniated lower eyelid fat pockets, also known as eyelid bags, the treatment is surgery. It's a natural-looking blepharoplasty that I perform for my patients to improve the prolapsed fat pockets. And this is a technique that I do through a procedure called the blepharoplasty, where the incision is usually made behind the eyelid, where the excess fat is identified, slightly removed, and the remaining amount is actually repositioned to improve the underlying volume loss. In most cases of patients that have prolapsed fat or lower eyelid bags, there's also associated volume loss at the same time along the infraorbital rim. So my procedure attempts to address the fat prolapse, but also attempting to address the volume loss. So it addresses two problems at the same time. So if somebody just has true volume loss with no associated fat prolapse, there are treatments that can help improve that form of dark circle. Dark circles essentially are when patients notice a darkening or some sort of aging process in their lower eyelids, and they term that as dark circles. But certainly a true dark circle is when somebody just has a true hollow that's present, and that's volume loss. And to address that, volume augmentation is recommended either through injectable fillers that can be done in the office or fat grafting, which can be done in the office or in the operating room. I personally prefer injectable fillers for somebody that truly has hollowing because it's more predictable and it's reversible if there are issues. The products that I use around the under eyes are specific and only hyaluronic-acid derived so that they can be dissolved if there's any issues. I do not use any other stimulatory fillers such as Sculptra or Radius along the under eyes. It's something that I do not recommend, and because ultimately if there are issues, those products cannot be dissolved. The filler of choice that I like for the under eyes at this point is Restylane. I've been using that for almost 15 years. I'm very comfortable with that product. It has a very good compatibility to the lower eyelid area, but it's really important to know that patients have to be true candidates for under eye hollowing. If somebody has fat prolapse and they actually need a blepharoplasty, but they're given an alternative as a filler treatment, they're not great candidates. They're likely not going to be happy with the results. They're still going to notice that they have dark circles, and there can be issues with the product because it's overfilled perhaps or not injected in the right place, and patients can present with swelling and stretching out of the skin, which can be really problematic for the patient. And that's where I come in and try to help them out as much as I can by rehabilitating their skin, dissolving the filler. So it's really important for the doctor to identify what is causing the dark circles. So if they truly are hollow, injectable fillers is a great option for these patients, which can be done in the office. The next cause of dark circles is hyperpigmentation, which I see a lot in my practice. These patients have a darkening of their skin. It looks hyperpigmented relative to the rest of their face. This can be due from various causes. It can be genetic, it just run in their family. It could be ethnic, ethnicity. Patients' ethnicity can lead them to be more prone to having hyperpigmentation issues along the lower eyelid. It could also be due to sun damage. Chronic sun exposure without adequate sun protection can also lead to hyperpigmentation. Sometimes patients can actually have prolapsed fat underneath, and the thin skin and the vessels underneath within that fat can actually cause a reddish hue or a purplish hue along the lower eyelid. And that form of hyperpigmentation can often be improved with a blepharoplasty because the fat that's really getting close to that thin skin with those underlying vessels is debulked and slightly repositioned to a new place, so that fat is not directly on top of that thin skin anymore, so that color hue can actually be improved. Now, if somebody truly has hyperpigmentation where the skin is darkened, that is very difficult to treat. Non-hydroquinone products, topical products such as Skinuva Bright could be an option. Hydroquinone itself, applied topically for about a month or so intermittently, can be an option. Again, these topical products, though, do not address that issue entirely. So patients just need to be known about these limitations of true hyperpigmentation. In certain cases, a light chemical peel or a light fractionated CO2 laser may be applied to help improve some of that hyperpigmentation if it's associated with some sun damage, but that needs to be evaluated on a case-by-case basis to see if that's indicated, because if it's true hyperpigmentation and you're applying a chemical peel or a laser, that can actually make the hyperpigmentation worse. So there are some limitations with that form of dark circles. Another form of dark circles is due to allergies, and there's no surgical treatment for that. Allergies can actually stretch out the skin, can cause prolonged hyperpigmentation, can even result in some hypertrophy or prolapsed fat. So surgery may ultimately be warranted in these patients that have chronic allergies. But the most important thing is if you truly have allergies that are resulting in dark circles, it's important to get the allergies treated. It's important to get an allergist on board to make sure the allergies are identified, the trigger factors, and making sure that you have the right plan in preventing and treating the allergies when they occur. Once your allergies are subsided, and again, this is not a common issue that I see in my practice, but I do see it every so often. But once the allergies are completely controlled, and that we know what the trigger factors are, and the residual result of baseline examination of that patient presents fat prolapse, some stretched out skin, well then a lowered blepharoplasty with fat repositioning and possibly a light chemical peel or fractionated CO2 laser can be a great option for that patient. So the most common reason in my practice that causes dark circles is prominent lower eyelid fat pockets. That by far is the most common reason of dark circles in my practice, along with volume loss. So a blepharoplasty with fat repositioning is often the most successful treatment for most of the patients that I see in my practice for dark circles. So when you come and see me for an examination for dark circles, that examination involves myself taking a look at your eyes and identifying the extent of fat prolapse that you have. I generally will look at you, just normals face to face, but I'll also have you look in certain gazes, to the right, to the left, and also looking up. Particularly important when you're looking up, because when you look up, I can really see the extent of the fat prolapse that's present. Then I'll go into identifying the extent of volume loss that you have along the lower eyelid rim or the infraorbital rim area. Identify how hollow you are. How much fat do you have? Is the fat that's present in prolapse adequate enough to improve the underlying hollowing? And if it is, we'll move forward with a fat repositioning blepharoplasty procedure. But if it's not, and you still have some significant volume loss, and also in the mid-face area, that fat repositioning alone cannot help, that's when we'll discuss fat grafting. I often combine fat grafting with fat repositioning in my blepharoplasty cases. There are two different techniques. Fat repositioning uses your own native fat from your eyelid and to reposition that fat to improve the hollowing, just directly below where the fat is prolapsed along the orbital rim. You can actually palpate that area. In the exam that I'll see you for, I'll also move you side to side and determine how much volume loss you have in the mid-face area and the cheeks. In those areas, if there's significant volume loss, I'll either harvest fat from the abdominal area, if you have adequate fat, or within the inner thighs. These two areas are great harvesting sites for fat because there's adequate fat there, and that fat is very stubborn to remove or to reduce when you're trying to lose weight, and so that's a great fat to consider for fat grafting because it's a very stable fat. Harvesting the fat is done through a closed technique in my surgeries, where I use a dermapose system where the fat is never exposed to air throughout the whole entire harvesting process, and before I inject the fat, I actually strain it through a micronizer, which is at essentially at 800 microns in size. So that is 0.8 millimeters in diameter, which is a very small particle which prevents the fat from being lumpy or bumpy, and it's incredibly smooth. And I talk a lot about this in my videos in the operating room and how the fat looks, and it's incredibly rich in quality and super pure. So when you actually inject it, there's no lumps or bumps, and it is beautifully placed just right below where I reposition. So it works really well for patients that have volume loss in the mid-face and cheek areas. So the examination is really important to identifying extent of fat prolapse, hollowing along the infraorbital rim, and hollowing and aging changes around the rest of the face. The other thing I look at for is skin texture. How the extent of sun damage, the extent of excess skin. Does excess skin need to be removed at the same time to improve the dark circles, or would a chemical peel or fractionated CO2 laser be a better option to improving the skin texture rather than removing skin through a skin pinch? And then in the examination process, we'll go over your history. It's really important for me to identify any prior fillers that you've had in your lower eyelids. There's a lot of patients that see me and forget that they've had fillers about 10 or 15 years ago and thinking that it's been dissolved. But that's not true. Fillers can last a very long time. In fact, I've had many patients that have had fillers over 20 years ago and that still have issues with those prior fillers, and they had no idea. And they just thought they needed surgery. They did need surgery because they had prolapsed fat pockets, but we needed to dissolve all that filler before surgery and rehabilitate their skin. So history taking is really important at the examination process, in the consultation as well, to make sure that I have a clear picture of what your history was, if you've had prior fillers, if you've had prior surgery, to identify what exact surgery you've had around the eyes, lower eyelids for instance, to get a better plan of how I can help rehabilitate your eyes and your dark circles. If you're ready to get rid of your dark circles and look as vibrant as you feel, I'd love to help you. Schedule a consultation with me in person or schedule a virtual assessment with me through my website, and that's how we can start to get to help you out. Make sure to subscribe, comment, and thanks for watching. We'll talk to you soon.